Hello. Welcome to the Navigating Cystic Fibrosis with CF Foundation Compass session. My name is Anna Batista. I'm a fellow CFer and I've been through 2 lung transplants. I currently live near San Francisco with my boyfriend and our sweet dog. I love trying tasty food and doing crafty things. Like many of you, I don't know a lot about Compass, so I will be learning along with you. Today, I'm the moderator for this session, and I'll be introducing our speakers in just a moment. But before I do, I wanted to provide a few housekeeping items. This session is being recorded. We will give you'll get an email when when the session recordings are available. We will also be taking audience questions during this session, so we encourage you to submit your questions at any time into the chat box, and we'll do our best to answer as many questions as possible. Before we begin, I also want to remind everyone of our event conduct guidelines. Please be considerate, open-minded, and respectful. We also ask that you do not use any malicious or offensive speech, and that you don't ask or give medical advice. If you feel at any time that the conduct guidelines are being violated, please contact a CF Foundation staff member in the help desk. We also have counselors on call today, so if at any point you feel overwhelmed by the conversation and need to talk to someone, you can find a counselor also in the help desk. So let's get started with some quick introductions.
Hi, I'm Rebecca McWilliams. I am with the CF Foundation Compass, and I have been with Compass for the last 7 years. And I live in Delaware with my husband and my 2-year-old daughter.
Hi, I'm Katie, a 43-year-old adult with CF and a content manager at an ed tech company. I live right outside DC with my partner, Dave, and we love to travel, and I love to eat cheese as much as possible.
Thanks for being here today, Rebecca and Katie. We've got a very informative session for you all today, so let's jump on in. Rebecca, take it away.
Thank you, Anna. All right, so I'm gonna share a little bit about who and what Compass is and some of the resources we have. And then Katie and I have prepared some examples of what calls with Compass can look like. So we're excited to share those with you too. Next slide. So what is Compass? So we're a team of case managers who help you navigate really anything. Some big areas are insurance, whether that be finding new insurance, picking the right insurance, issues with your insurance, helping connect you to different financial resources, helping you get answers to your legal questions, and really anything else. We leave the other pretty broad because we're constantly finding new resources and information. And we'll also touch on a few things that are outside of our expertise, but we refer to better qualified organizations to still help you get answers to. And our goal is really to help lessen the burden created by any of these challenges. So it could be a financial burden, it could be a time burden, or just the mental load of maybe navigating these challenges alone. So we're really there to help shoulder some of that and walk through it with you. Next slide. And just a little bit about our eligibility. Really, it's just that you maybe have CF or are suspected to have CF or CRMS. That could include pre and post transplant. It could include working with your families, caregivers, providers. Really, that's really the only requirement we have. We don't have any insurance criteria, income, citizenship criteria, care center criteria. The only thing I'll note is most of our expertise lies within U.S. resources and the U.S. healthcare system. So while we can help internationally a bit, we're not experts in other countries' healthcare systems. So we have some limitations there. And as always, Compass is free and confidential. Next slide. And who are your Compass case managers? So the states in green are states where we have case managers, and the gold stars we have case managers who are fluent in English and Spanish. And we also use a language line too for a number of other 240 languages, but we do have fluent case managers in Spanish on staff. And our case managers, most of them have been with us for quite a while. So when we added up everyone's time with Compass, that equaled over 100 years of working specifically with Compass, helping the CF community. Next slide. And very brief snapshot kind of some of the things we can help with. So helping you look at your insurance options, helping you weigh pros and cons, talking about if you get a bill that you don't understand or you're having a coverage issue or something is being denied, really troubleshooting any sort of like insurance, pharmacy issue, connecting you with financial assistance resources, different support programs that we know of, helping you get answers to your legal questions, navigating resources, and coordinating benefits and care throughout the pre, during, and post-transplant journey. And then also we have a lot of educational tools and resources for really navigating anything. And I'll tell you a little bit about those in a few slides. And just quickly want to touch on some of the areas we don't have expertise in. So we aren't medical experts. So we really leave care to you and your care team. We can, of course, help facilitate if you're having like an issue getting something covered, or like after you and your care team have decided something is something you'd like to try, we can help make sure you have like the financial resources and the insurance coverage for it. But we don't provide any direct medical advice ourselves. We also don't offer any direct financial assistance through Compass. So we refer to other organizations, whether that be like some of them are CF organizations, some of them are local, might be county, state, federal programs, national programs. So all sorts of different financial assistance avenues we explore. We also don't provide any mental health counseling in-house. So we are not mental health counselors ourselves, but can definitely help connect to like financial resources to help pay for therapy, help you look at providers that might be in network with your insurance, that kind of thing. And then we also don't recommend any specific for-profit businesses or services. And we don't provide any legal advice in-house. So we have a lot of really great legal experts that we can refer to because they are better equipped. And really because the legal space is so vast, we rely on other experts to help us with that legal advice for you. Next slide. And then these are some of the educational resources that I was talking about in the beginning. So we have a resource database that is a website you can access. It doesn't require a login. It's just a website. You can access it on a mobile or computer. And you can use this website in a variety of ways. Like if you have, maybe you're curious about some of the things we've found that we've vetted for the CF community. If you're maybe not sure if like you have something in mind, but are not sure if we have found something for it, this is a good place to look. But it's not all inclusive. So we're constantly adding to it every day. So even if you don't see something on there that you are looking for, would recommend still reaching out to us, because either we might know of it and it just might not be in there yet, or maybe we haven't even, we've never had that request before and we've never known to look for it. And then we might be able to find something. So, so it's meant to just be something that's available maybe if we're not open or on the weekends or something like that, but is not an all-inclusive list of all the resources that we have. Next slide. And this is another resource we have that's sort of on demand and you can access at any time. So we have a Navigating CF YouTube video series. So these are short little videos that you can access anytime. Some of the current topics we have include health insurance for CF, insurance denials, appeals, understanding Medicare, health-related social needs, and costs of care as a young adult. So those are some of the topics on there right now. And again, this is not necessarily meant to replace working one-on-one with the case manager for your specific situation, but is there as a resource if you maybe are anticipating a transition or it's too early to really do anything yet, but you're curious about if something might change with your insurance, you're going to maybe start a new treatment at some point, you're making a big life decision. They're kind of just there to get you thinking of questions to ask and better equip you for when that transition is. So just another example of information you can access anytime, even if we're not open. Next slide. And then this is these QR codes have a lot of different resources based on kind of some of our most popular questions and topics. So health insurance is complex. Financial wellness is complex and on everybody's mind. So we have a lot of resources. These two QR codes have a lot of different links for either like different parts of cff.org, blog posts from other people who have been where you are, quick summaries of complex topics, longer articles, worksheets, like all kinds of just tips and tricks and resources all in one link for you. Next slide. All right, and then this is our contact information. So to get personalized help or to get questions answered, we have a phone line that's open Monday through Thursday, 9 a.m. to 7 p.m. and Fridays, 9 a.m. to 5 p.m. And then we have an email you can email at any time. And then we also have a way to submit an online form if it's easier to go online and submit a request instead of calling. You can submit that request at any time, and that basically starts a case for you, and then a case manager will reach out to you. All right, and then that's going to be the last slides for the presentation. There are a couple other slides in here that go a little bit more into depth into the different things we help with. So those will be available after the presentation if you have interest to go back and look at those. But that'll be the end of the PowerPoint for now. All right, and then so now Katie and I are going to show you how an initial call with Compass could go. And we just have a couple notes that we wanted to share before we get started.
Yeah. So, as an adult with CF, you do want to prepare a little bit before you make that call. And some things you might want to think about in preparation are how much time do you have to set aside for the call? What materials or paperwork might you need to gather? If it's about insurance or your job, you might need some HR or insurance paperwork. That is going to help you communicate the best to Compass the things that are really detailed about your situation. You also want to think about cost, like how much are you thinking about paying or can afford to pay? Think about that before you have the call, and then determine your priorities for the call. What are your goals? What are your objectives through that call? And what do you want like a hopeful result to be? And then also kind of know what the timeline is you have to have around making this decision or the timeline you need for assistance and communicate that timeline to Compass. That's going to make things go a lot smoother.
And then just a few things about Compass before calling, other than what we've gone through about who we are. So, so at the beginning of any initial conversation, like the first time we're interacting, we'll collect some demographics and some contact information. One, if we get disconnected, and to help us provide you personalized guidance and resources along the way. Like Katie said, it can speed up the process if you have as much information as you can when you call, but we can still figure it out, even if you have limited information or you're not even know where to start, or what questions to ask. We can meet you wherever you are. And then most of our communication is through either phone or email, but we do have Zoom or Teams capability if we need to do a screen share. So like an example would be Compass, the case managers can't like take your username and password for a website and log in for you somewhere. So like an example might be if you need help reviewing or finding information that might be behind a login, like let's say like a benefits website for your job, or like finding something in your insurance portal. Those are good examples where if you like can't find it, we can do a screen share where you can log in and still keep your password secure, but then we can help you kind of like navigate in there and find what we need for whatever the question is. And then just wanted to note too, Compass case managers are knowledgeable about CF and transplant specific treatments. So we're familiar with the names, and we understand that an issue or a gap in therapy is a big deal, and that can be stressful. So we do have that background, just so you know when we call. And a solution with Compass usually involves like Compass and you working together. So our goal is to partner with you, and we'll show you kind of what that looks like in our example calls. Okay, so I think we're ready to get started. Katie and I are going to start us off. Okay, here we go. Thank you for calling CF Foundation Compass. This is Becca. How can I help you?
Hi, yeah, my name's Katie. I'm an adult with CF, and I'm calling today to talk to someone about some insurance questions I have. I've never called you before, so I'm not really sure if you can help with this, but I thought I'd try.
Okay, yeah, sure. So maybe we can talk a little bit more about the questions you have, and then I can share how Compass might be able to help with those. We can take as much time on this first call as you have time for, but we probably need at least 10 to 15 minutes to get all the information, if that's okay.
Yeah, I think that will work. I'm willing to give it a try. 15 minutes sounds good.
Okay. All right, great. So do you have questions about, is it your current insurance, or are you looking at choosing a new plan?
Yeah, actually, kind of exciting. I am looking at choosing a new plan. Thanks to Trikafta, I'm really healthy enough to make like a career leap, which is really exciting. I've been a public educator for 20 years, and now I'm looking to move into the private sector. Um, and while it's really exciting, I am a little nervous that the insurance is not going to be good enough for me and my needs. And so I just really want to make sure that I'm picking the best plan that's going to cover Trikafta and all of the other needs that I have, hopefully with the least amount of cost to me year over year.
Yeah, absolutely. Yeah, so for insurance plan comparisons, what we can do is we can review your plan options to make sure they cover like your medications, your providers, um, assess if they're going to meet your needs for the upcoming year, like if you already have maybe procedures or surgeries planned, or you have pretty routine things like every 3 months you get X, Y, and Z done, like things that we could plan for, that we could factor in to those plan details. And then from there, we can narrow down the options to several that would be the best fit if you have like a lot of options. And then we'll review those plans with you to make sure that you understand the coverage, you understand the differences between the plans. And we can't recommend like maybe a specific plan over another, but what we can do is make sure that you understand each plan and feel confident to make the best decision for yourself after like we kind of talk back and forth, and we can answer any questions you have. Does that sound like what you might be looking for?
Yeah, that would be really, really helpful for me. I've looked over the plans and I'm pretty sure like I know which ones are going to be the best, but I would just really appreciate like a second set of eyes that like does this kind of often and confirm that my thoughts are like right on track. and also will help me see any holes about things maybe I haven't considered.
Sure. Yeah. Okay. So do you have you can either like tell me over the phone, or if you have it in a spreadsheet already, do you have a list of your medications and providers so we know what to look for under these new options?
Yeah, totally. I'm a spreadsheet queen. Spreadsheet queen. I have it for you. Can I just email that to you somehow?
Sure, yeah. And then what about the plan information? Do you have like a URL to the plan documents, or is it like a paper copy? If you can email that also, you can send all of that to compass@cff.org. And then if you have time to do that now while we're on the phone, I can make sure I get the email and take a look at the documents to see if it's going to be enough to start working on that for you.
Yeah, I can email all of that to you now.
Okay. Okay, perfect. All right. And then, so as we're looking at those options for you, is there a type of plan that you are used to, like a higher premium, more predictable costs throughout the year, or like a lower premium and then the costs for things kind of fluctuate throughout the year, or do you have a preference?
Oh, yeah, I have a preference. I'm a planner. I like to know, like, kind of what my costs are gonna be. So I usually do get a plan with a higher premium and really predictable copays. That way I can really budget for things through the year and not, like, have a huge surprise.
Yeah. Okay. Definitely understandable. Okay. So then that will help us as we're looking at those plans. And then aside from new plan coverage, are you already using any copay assistance
Yeah, I
to
do. I
help reduce
use,
costs there?
yeah, I have the Vertex copay assistance for Trikafta, and I
Okay.
also have Care Forward for my Creon.
Okay, perfect. All right. Just want to make sure we're maximizing your out-of-pocket savings there too.
Yeah,
Okay.
thank you for asking.
Okay. All right. So I got your email with the plan information and your providers and medications. So what I'm going to do is I'm going to put all of this information together so a case manager can do a little bit more research on the plans and get back to you. So we can give you a call back and sort of send you an email with the findings, or the case manager can just email you when they have more answers. Do you have a preference?
Yeah, I mean, if you could email me and we can schedule something from there, like once the case manager has a chance to look at it, that would be really good. I really appreciate your patience and your time today. I can tell you are really knowledgeable about this and CF related stuff and all the ins and outs, and it makes me feel like really comfortable reaching out to you again.
Of course. Yeah. Thank you. All right. Well, thank you for giving us a call today, and I hope you have a great rest of your day.
Yeah, you too. Bye.
Thanks for giving us such a great overview of a sample Compass call. I personally learned a lot from it and found it pretty informative. Insurance is one of those things that I usually think of Compass for, but I personally feel like it can be a little scary to call. So it's helpful to see what that process would be like. And thankfully, the people at Compass are very familiar with insurance and all the things that we as CF people need covered in 2024. They actually did 2,600 insurance comparisons, which was up 17% from 2023. The increase is attributed to people seeking coverage after losing Medicare or Medicaid, changing jobs, moving, or efforts to avoid accumulators or cost relief programs. They also supported over 900 people with evaluating their insurance coverage during the open enrollment period. Case managers were able to maneuver around unique challenges such as lack of transparency in plan documents, community members receiving conflicting information from brokers or manufacturers, and even over 350 expedited cases to ensure coverage before time was up. So if you have an insurance question, they have probably dealt with it already. Our next call, we're going to see something that can be a little bit harder to approach, changing care centers. So you might want to change a care center for a variety of reasons. Maybe you're moving from pediatrics to adult care or moving altogether. Maybe you're not quite happy with your experience of care, your insurance coverage is changing, or some other reason. Whatever that reason is, Compass might be a good resource for you. So let's see how that call would go.
Thank you for calling CF Foundation Compass. This is Becca. How can I help you?
Yeah, my name's Katie. I'm an adult with CF, and I'm calling today because I am really not comfortable at my care center. I'm moving and I'll be too far away from the current center. So this whole process is making me really nervous because I've been with the same care center my entire life and this change has to happen.
Yeah, absolutely. That's a big transition, and I'm happy to talk through some options with you. Um, so one, we can definitely look at new care centers in the area where you'll be moving. We have a care center finder on our website where we can filter by state or zip code, and it even includes some like stats or data about those care centers. So I could share that site with you, and then I can also pull some care centers that will be close to where you're moving to start.
Yeah, that would be great. I'd be really interested in exploring that.
Okay. And then what about your insurance? When you move, will you have the same insurance? Like, do you need help maybe confirming if that one, if the new care center will be a network, or are we looking at maybe you'll have new insurance when you move?
Yeah, luckily I'm keeping the same insurance that I have now, so that won't change, but making sure that the new center will be able to take it is going to be really important to me.
Okay. All right, perfect. So, so I can give you the information I can pull the closest centers that are going to be around you, and then also I can confirm if those centers are in network with your current insurance. And then how it will work is when you've picked a new care center, you would call and schedule the appointment and coordinate any record transfer from your old center to your new center. And then of course, if you're having trouble navigating the like record transfer, we can always help you troubleshoot that. We just can't request the record transfer for you. How does that sound?
Oh, that sounds great. Thanks for helping me with this. It's kind of really nice to not have to do it completely alone for the first time.
Yeah, yeah, absolutely. And then, so not knowing yet what center we'll be looking at, or if your insurance is in network, let's also talk through some strategies in the off chance like you found the perfect center, you want to go there, but they don't take your insurance. So we're not out of options at that point. One, we can explore maybe if your current plan has any out of network benefits and like a cost difference, what that cost would look like. We can also research the process for it's called like a single case agreement or like an out of network exception where your plan makes an exception to cover that center as in network. And then we can also look at the hospital's financial assistance policy and see if you would qualify for that, or if it would cover you even if your insurance was not accepted at the center you want to go to.
Oh, wow. I had no idea that those were even options.
Yeah, there's always options, and we'll keep looking and exploring options until we find a good solution that you're comfortable with. So I will be in touch after I check your insurance network, and then we'll go from there. And then feel free to reach out if something comes up before that too.
Okay, awesome. Thank you.
Okay, Anna might be frozen, so we'll just keep going to the next one. Okay, so for our last mock call, we're gonna talk about getting a vest covered. So this conversation is about a vest, but it could really apply to any cost you might have, like rent or food or medical supplies or prescriptions. So we will jump right into it. All right. Thank you for calling CF Foundation Compass. This is Becca. How can I help you?
Hi, yeah, my name's Katie. I'm an adult with CF, and I'm calling today to talk about getting my vest covered. It's so expensive. It's like a new car, and I'm having a really hard time navigating how to get this covered by my insurance or how to pay for it, financial support otherwise.
Sure, sure. We can definitely help you with that. It can be it can be very overwhelming to navigate a new treatment and then all of the different parties involved. So for a vest, typically the first step is your provider writes a prescription and sends the prescription to the company that makes that vest. Do you know if that has happened yet? Have they told you that they've sent the
Yeah,
prescription over?
yeah. I talked to my doctor about, and we talked about Hillrom because it seems like it's more portable than the other one, but I'm not sure if they've sent the prescription yet.
Okay. All right. So how about this? We can talk a little bit kind of about what the process is and then financial resources, things like that. And then if we have time, maybe we can call Hillrom together to make sure they've received the prescription.
Oh, that would be really great. Thank you.
Okay. All right. Awesome. So once the prescription is with Hillrom, they'll assign a reimbursement specialist to you that verifies your insurance benefits and kind of goes over what your insurance will pay, what the cost would be to you. And then if they don't mention anything about financial assistance, you can also ask them about applying to see if you're eligible for any financial assistance through Hillrom. Um, and then there's a couple organizations that have grants that can be used for medical devices as well. So I can send you the information for that application to help with any balance you might have after your insurance pays, and then any help from Hillrom's financial assistance. And then if there's still some sort of balance, there's some resources that you can apply to help cover that cost. The application does require you to submit a letter from your care center just verifying CF diagnosis. Do you have any questions or concerns about that?
No, no, getting the letter will be easy. My, genetic testing is pretty firm that I have CF. So I don't think that, that's gonna be a problem, and so I'm hopeful that this is an option.
Okay, all right, sounds good. So I'm going to send you that application, and then do you have time now? Would you like to call Hillrom together and see where we are in the process?
That would be amazing. If I could check this off my to-do list today, I would be so happy.
Yeah, definitely. Okay. All right. So let me put you on hold for just a moment and we'll conference them in. And then depending on how that call goes, we can schedule a time for me to follow up with you to make sure you have everything you need.
Oh, okay, awesome. Thank you so much. This is really helping me today.
Yeah, absolutely. Okay. And then she might still be having technical difficulties. So I'll just share a little bit more about some of our Compass stats in the meantime. So last year in 2024, 772 people called about copay assistance, which is an increase of 18% from 2023. We also had an increase in requests for health related social needs, like examples of those are finding employment, transportation needs, home repairs, and paying rent or mortgage. And then finally, Compass has saved the community over $3 million for the second year in a row. And this was achieved through things like some of the calls, examples that Katie and I have done, like referring to financial resources to pay for medical expenses, resolving coverage issues that would have otherwise resulted in a big bill to you, and referrals to organizations to help with different social health related needs like rent and utilities. And then I believe we'll do, hi, Anna.
Well, I'm definitely learning new things about Compass. Um, and at this point, I'm sure our audience has some questions. So let's get the Q&A started. If you have any questions, please put them in the chat box, and we'll try and get to as many of them as we can. You should see a Q&A at the top of your chat, and that's where you can put your questions. Here's one question I have, Rebecca. Let's get started on some.
Yeah.
Can Compass help with job hunting? What about getting accommodations for a job?
Yes. So for job hunting, we refer to there are these career organizations in every state called vocational rehab, and they are these really amazing programs that can help anywhere from like helping you pay for school, helping you pay for training, helping get you connected to different jobs. Claire's Place also has a great program called Work Proudly that helps people with CF identify careers and cover the cost of job training and gain skills to find a flexible career. And then for anything accommodation wide, we refer to workplace advocacy organizations. One of those is Job Accommodations Network, that's really great for and really knowledgeable about workplace advocacy.
It looks like Anna's back.
I am.
Anna.
Hello. Another question we have is, how can I get help with financial assistance programs?
Yeah. So the first step would be to reach out to us, and we can either we might know of a resource already, or we might have to research it and get back to you. And then how it works is every program or resource that we find has their own unique like criteria and application process. So what we could do is, to the best of our ability, make sure that like you're eligible for that resource from what we can confirm from their application process. Kind of go over with you if things like if you think you can get the documents that the application needs, if you have any like concerns about it, and like review the criteria and process with you and help you navigate any roadblocks for completing the application. But the first step is just to give us a call or submit an online request or send us an email, and we'll go from there.
Cool, thanks. Another question we had is, if it's taking a while to hear back from Compass, what is the best way that you could follow up with someone?
Yeah, so if it's taking a while to hear back, we have I'm sure we can put in the chat too, like our email and our phone number where you can follow up, or if someone is specifically needing to hear back, I can also look that up and make sure that somebody gets back to you. But our phone or our email would be the best way to reach out to follow up on your case.
Awesome. And actually, a follow-up to that would be about how long can people expect a case to take to get all the information they're looking for?
Yeah. How long could a case take? It really depends on the request. So like a lot of things, we've kind of revamped our resources this year. So more and more questions we get, we can at least give some sort of answer or information just on that first intake call. So that just helps move, like gets information and resources to you quicker. If it's a more, so it could be that it could be resolved the very first time you call. If it's a more complex, maybe like it's like an issue or something's weird with the pharmacy or something's weird with the insurance, that could take a little bit longer, just depending on kind of like all the parties.
Mhm.
Yeah, so I think our average turnaround time for cases is around like 7 days. So maybe like that would be a good average, with some cases falling on either end of that spectrum.
Mhm. How can you help someone plan for a lung transplant?
Yeah, so we can help with insurance coverage, financial resources. A lot of times, so if you're in the process or like talking about a transplant, usually there's a transplant center involved, and the transplant social workers and financial coordinators are really amazing and really knowledgeable. And sometimes we've worked even like with them to address hurdles, like if there is like insurance is not in network, or someone doesn't have enough insurance and needs like a secondary in order to cover all the bases. We've worked with transplant centers to make sure that person is like ready to go, and insurance is not like a hindrance to them being able to move forward. But a lot of connection to different like support programs, whether that be like through community partnerships or other organizations that have support groups, financial assistance, coverage issues, all sorts of things.
Cool. Can you help with Social Security benefits?
Yes. So we partner with the CF Legal Information Hotline. They handle all of our Social Security related questions, and they are really, really great, because they can anything from like eligibility, applying, any like back pay or questions after you already have disability. So how it works is we can provide you the information for CF Legal Information Hotline, and then you would reach out to them directly and work with them. And then any services they provide related to disability are free of charge. The foundation covers that cost. So if they think that you would be a good candidate and choose to represent you, that would be free representation, and the foundation would pay for that.
That's awesome. Katie, this one is for you. Can you speak towards your personal experience with calling Compass? Like, what did you like about it? Would you call again? Were you nervous? Kind of how did that go?
You might be muted, Katie.
Oh, I was coughing earlier, so I thought I should mute myself. So yeah, the very first mock call we did was my experience this past summer in changing jobs. And I loved that they were very reassuring and quite like my adult care team, like we're a partner in that call and in my choices. And ultimately the choices were mine, just like my care team. But it was just reassuring to have someone who had experience in these issues, the insurance piece every day. For instance, my state outlaws copay accumulators, which is great, but the insurance plans that I had to choose from were not based in my state. So I thought that I was going to get away with like no copay accumulators when I actually now, in fact, do. So that would not have been something I would just have known. So having that like experience of those issues they see every day was really reassuring and helpful in my eventual decision that I made.
Cool. And Rebecca, what do you like about working for Compass? What are some of your favorite parts?
Oh gosh. I think some of my favorite parts are I think just getting to sort of like grow up with people, like you kind of, and hopefully it's like we get to stay connected, not just because you're always having a problem, but even like some people will reach back out and just share like an update. So it's really been fun over the last 7 years to just get to like walk with people, and like maybe we really bonded over like a really bad insurance thing, but now everything is like fine with their insurance and they just check in and let me know that it's going great. So it's just been really fun to like grow with people, like myself growing and just going through life. Yeah, I mean, we always joke that it's like sometimes it's bad when you hear from people a lot because it's like, no, something, I don't want something to be wrong, but some people have good updates too, and not just like insurance problems that are plaguing them. So, yeah, that's been really fun.
Cool, thank you. Another question we have is actually for me as to why I haven't reached out to Compass and what I learned. And I would say for me, a big reason why I haven't reached out is honestly, it just kind of felt too scary to call because I'm like, I don't know. I don't even know what to ask. I'm like that unfamiliar with insurance. Like I use it, but I don't know a whole lot about it. And then for me also, I'm not in a spot where I really need to switch insurance, but I will be. So it was helpful learning, like I could probably call and just have them review the plans that I have when it comes time to do that. And yeah, so I learned a lot from this session. And let's see, I think we are about out of time. So we'll go ahead and bring up the last 3 slides of the PowerPoint real quick and just review those, and then we will close out.
Sure. Yeah. So, so diving a little bit deeper into the insurance coverage issues. So some of the things we see pretty frequently are maybe like an unexpected bill, that doesn't quite make sense, or coordination of benefits if you have more than one type of insurance and they are maybe not getting along as to who pays first and who pays secondary, things like that. If you need to switch pharmacy, like if your insurance changes your pharmacy benefit manager or changes specialty pharmacies and you have to navigate switching your medications, or you have multiple pharmacies, things like that. Denials for different treatments, network exceptions, like if something is out of network, or like something your insurance stops, or care center or something stops accepting your insurance in the middle of the year, things like that. And then anything benefit verification. So anything you have, if you have something coming up and you want to get an idea of maybe what it will, how it will impact you, what it will cost, anything benefit verification wise. Okay, and then next, so resource navigation. So other than your typical things for like copays, premiums, all of the like durable medical equipment, vitamins, supplements. So we could, and depending on your insurance, there's kind of like different things you're eligible for. So we kind of take a look at like everything you already know about, everything you're already using. Maybe there are things that you're not currently using. We can plug them in to fill the gaps and help you save money there. And then the other part of resource navigation would really be like anything else. So if you go to the next slide, these are just some like common examples of things that we have resources for. So transplants, living and food expenses, medical, non-medical transportation, fitness programs, grants, and programs for pregnancy and adoption. There's a lot of scholarships, resources for genetic testing. So like this list really is infinite. There's if you have a question and you ask it, there's a possibility that we might have a resource for it, or we will look for one. So the possibilities here are pretty endless. And sometimes it even turns out that like maybe the thing you call about, we like can't find a resource for, but in that conversation and getting to work with you and talk to you, maybe we discover something else that might be a resource and kind of might still like free up some money there. So usually there's still like something we can do, even if we can't find a resource for one specific thing. And then if you go to the next slide, and then finally legal. Yeah. So for anything Social Security related, we have the CF information hotline. And then for anything, we've touched a little bit kind of on like the employment and school and any other legal issues. So for any of those other ones, we refer to other organizations who either like bar associations, like nonprofit resources that have trained lawyers and are better equipped to make sure you have the information you need.
Awesome. I think we have just a few more questions. Can Compass help with getting like accommodations for college or school in general?
Yeah, so we have for school accommodations, we have a number of educational resources that we refer to learn about legal rights or tools for self-advocacy. And then sometimes like referring to local legal support throughout through other organizations. And also on our website, we have a number of like blog posts and articles from either like school nurses or social workers or families themselves on kind of like what they have used as templates for school accommodations or like tips and tricks for working with college or with school, so that you have this really good relationship and can get the accommodations that that you need.
Mm-hmm. And then we know Compass is familiar with CF care, but what about transplant care? If you have questions, are you familiar with like the medicine and stuff that people take for transplant?
Yeah, definitely. So definitely familiar with like post-transplant care, medications. Even if like you've had a transplant and you really don't go to like a CF clinic anymore and you just see your transplant center, yes, we can definitely still help at any point. And often if maybe you have like something else going on as well, as long as you have CF, and it doesn't even have to be CF related, what you need help with, we can still help you navigate whatever that is. So yeah, like post-transplant's a big one. If there are things that are related to transplant, still very much eligible. Yeah.
Awesome. Well, I think we are just about out of time. So thank you again, Rebecca and Katie, for being here today and for filling in while I disappeared. And we hope that you guys all got some good information from this. And as always, if you need personal information or just have more questions, Compass is the place to start. Just go ahead and give them a call. They can help you out there. And that's also where you can get personalized help, because obviously we're talking to a group of people, so we can't really go into details on specific cases, but we can do that if you call, or they can. So thank you again for being here, and thank you to everyone for participating and sending in your questions. Before you go, if you just fill out the satisfaction survey in the poll tab, that would be really helpful, and we will see you in the next session. Good night.